Okay, so
Can you please go to the first slide?
yeah, so I just had some okay, so I was gonna show this a bit later, but let me just come in. So I was first going to be making a very quick um, presentation, oral presentation on the importance of artificial intelligence. I don't come from the clinical side, I come from the data science side of things, and I would like today to underline applications of artificial intelligence and how artificial intelligence can help with TB, early detection, improving of diagnosis, and other aspects that I will be talking about in a minute. And at the end, I was going to show a couple of slides of projects we're working on in the area of TB with direct applications of artificial intelligence. So before I show that, so it's important to note that wherever there's data, there is artificial intelligence coming to help. And the way artificial intelligence comes here to help is in two fundamentally different ways. One is with the existing data or the existing tools such as X-rays or tomographies or biomarkers or any other form of more or less intrusive understanding of what happens in the lungs, with a combination of all these data sets and creating multimodal data sets, you can improve diagnosis, make it more efficient. So that's one way where you can have artificial intelligence do better than classical diagnosis. Of course, one of the biggest challenges with this, and this speaks to the ethics of the problem, is of course to make sure that these algorithms are representative of the patients that are going to be most susceptible and subjected to this disease, and as such you have to have representative data set. So this obviously raises a very important ethical issue. And the second issue is to how to convince clinicians. I mean, we as data scientists understand the improvements and understand the intricacies of the machine learning, but how to make these decisions and these artificial intelligence tools being transparent to clinicians and people that are going to make actual clinical decisions. But one thing is clear, there's a tremendous body of work that speaks to the fact that artificial intelligence can improve diagnosis. A second area where artificial intelligence comes in, not only in TB, but in other areas, is to be able to use less expensive techniques and less intrusive techniques. So there's actually a very interesting project I will talk about in a minute, which is basically using ultrasound. So ultrasound is non-invasive, cheaper, can be performed in the point of care directly, is something that can be applied on the patient. Of course, is certainly less accurate than other classical forms of inspection, being that of one example, X-rays or tomography. But with the help of artificial intelligence, you can actually make up for the fact that these techniques may not be as powerful as others, but with AI and the combination of other data sets, you can actually arrive at some form of diagnosis or screening the person and so on and so forth. And this is particularly important for the global south. Try to use artificial intelligence to use less expensive tools and less expensive analysis by using AI to enhance cost-effective tools. So those are two big areas. Now, before I will show the slides, I would like to touch upon two important issues as far as TB is concerned. First of all, TB is not a disease or a communicable disease in isolation. It actually depends a lot on air quality, the conditions of ventilation. So not only is ventilation critical, but the quality of air plays a very important role in enhancing the susceptibility of patients to contract TB. So it's also very important when it comes to respiratory disease that we monitor the environment and integrate the analysis of the patient with the environmental monitoring. And through that environmental monitoring comes the impact of climate change into diagnosis and future aggravation of the problem of TB and the treatment of TB in a mass scale and the impact of climate change on this disease. So, another area where there's a lot of thought and people working on is apply AI also on other non-invasive procedures. I just mentioned the issue of the I just mentioned, which I will show in a minute, of non-invasive procedures. But for instance, using breath analysis, what people exhale contains a bunch of chemicals. One of them is VOCs, and VOCs do carry certain information about what happens with a person that's contracted TB. And all this data, all this multimodal data actually helps early detection and with that improve outcomes. Well, another area where AI is also very important is to combine the data, including genomics, in order to really understand and predict how severe the disease will be and whether this disease will be resistant to treatment, which is one of the biggest issues in tuberculosis. So with that introduction, let me show a couple of slides. I hope I haven't lost them. And it looks like I have. Looks like I have lost the slides. Sorry, give me a second. Looks like we have problems with slides today.
What is eating on people's slides? Is there, is there something getting in here?
Yes,
and eating on the slides? Oh.
Okay, I think I was able to restore it. The problem is that it was open. No, I was not able to restore it. Excuse me. Can we go to the next person? I'm sorry. I just lost it in a sea of documents. Sorry about that.
Awesome. Also, I'm going to pass it over to Julian.
Good morning, everyone. My name is Georgette, and I am a communication specialist for AI for the Click, and I will help moderate this session. Thank you, Professor Bruce, for your amazing presentation. We can go ahead and start with Professor Loukia. I don't know if you're able to share your slides.
Okay, thank you. So now I think it could be okay, but I shared my slide with Professor Yahya in Morocco. If I cannot, he can share it for me.
Awesome.
Okay.
Perfect. Thank you so
Perfect.
much. All right.
Yeah. Okay, thank you. So I'm talking in the name of all the group of artificial intelligence for tuberculosis. My English is not so good, but I will try to share what we prepare for you. So we wanted to talk about leveraging artificial intelligence to combat the tuberculosis burden in Africa. I'm working in Kinshasa, in the University Clinic of Kinshasa, in the Democratic Republic of Congo. And the project is in 3 countries, Morocco, Burkina Faso, and DRC. But we are working also with South Africa and Qatar. Please, yes. So this is the presentation plan. We will talk about the situation of tuberculosis in Africa, the pathology of tuberculosis, some strategies, the global response, and something about our projects. And we will finish with the conclusion. Okay, so as we know, the tuberculosis is an infectious and contagious disease caused by a mycobacterium, the Mycobacterium tuberculosis, calling Cox bacillus. So it remains, till now, it remains a major health problem, despite the multiple strategies put it in the world, around the world. So the developing countries are the most affected countries on tuberculosis because they account around 80% of cases in the world. And it is the 8th major cause of death in that area. And we have many cases of resistant tuberculosis resistance. Please. Okay. As we can see here, in the map, we can see 2 regions, ASEAN and Africa. We have the biggest incidence of tuberculosis in our country. Please, slide, please. Okay. So in the last report of WHO, 10 million of people are affected by tuberculosis, and 10% of them have co-infection with HIV. And the same report said that 10% of that person are children less than 15 years old. So by incidence, we can say that Africa have 41 cases of death by 100,000 inhabitants. It's very, very important. That's why here, in this slide, we can see that the age group which is very affected is the age group between 15 years old till 55 years old. But it doesn't mean that the small people, the children less than 5 years old, they are not affected. The problem is that the to detect the detection of the disease at this age group is very difficult, because we know that one adult can contaminate 4 or 5 children. It means that when we have one adult, we can have 4 children affected. Slide, please. In the WHO have 6 regions in the world, and here we can see that for African region, the notification cases are growing. We have around 1.8 cases. And the other biggest region is the Asian region. For the others, you can see the number is very low. Slide, please. Same for the incidence. The incidence, it means the number of the person who are affected by 100,000 inhabitants. And we can see the same region, African and Asian. So the 3 countries of the project, Morocco, Burkina Faso, and DRC, we have more than 50 cases by 100,000 inhabitants. It means that the tuberculosis is not controlled in our area, because if we want to say that the problem, the tuberculosis is controlled, we must have less than 50 cases by 100,000 inhabitants. Slide, please. And same here for the incident TB cases. So the same region here are affected. In Africa, 2 countries, Nigeria and Democratic Republic of Congo, have the most cases. Please, slide. So if we can see the problem in our 4 countries, in Morocco, the new cases per year is stable, around 30,000 each year since 2015. In Burkina Faso, we have 38,000. In South Africa, 208,000. And in Democratic Republic of Congo, we have 324 cases, 24,000 cases. So the DRC still remain up than 30 to 300 cases by 100,000 inhabitants for all forms. And since 10, 15 years, the prevalence also is very high. Slide, please. As we can see here, for the 6 countries in Africa, the Congo here, we have more than 250. Like Nigeria, Nigeria has the biggest number of notification. Slide, please. And this study published at 2016 shows also, this is the result only for Democratic Republic of Congo, that the number is still going up. Slide, please. Even for the resistance, since now 6 years old, but the number, slide. Okay. So if we can say something about tuberculosis. Tuberculosis is contagious, as I say, by droplets. And Bruce tell us something about that. It means that for the protection, the measures are there, but it's very difficult to stop the progression of these kind of diseases that can be spread by droplets. The other problem is that the clinical symptoms are uncommon. So many signs are not only the signification of tuberculosis. And also, children has extrapulmonary tuberculosis, more than pulmonary tuberculosis. And for diagnosis is very difficult. So we have some paraclinic object to do the diagnosis. The X-ray, yeah, the X-ray can help, but the X-ray, the problem is that if 2 persons read the X-ray result, they can have 2 different results. So it's not a very good element of diagnosis. We have the microscopy, but the sensitivity and the specificity are not very high. We have molecular diagnosis with GenExpert, that is good, but the problem is that the majority of developing countries are not using everywhere this approach. And the treatment is still long, so all of these problems makes the tuberculosis like a big problem and difficult problem to resolve. That's why the WHO makes some strategies. So at 1993, the WHO declared tuberculosis as a global emergency. And 2 years after, so the first strategy, the directly observed treatment short course happened. And with this strategy, people everywhere could have a treatment for 6 months, because before each country can use its own treatment. But from 1995, so every country must follow the WHO strategy. But after that, some problems appears, like people with HIV, like multi-drug resistance. That's why at 2000, the WHO changed the strategy with the Stop TB strategy. Slide, please. So this strategy could include the TB HIV persons and also can provide drug resistance tuberculosis. But the problem is that when we attend the 2015, after evaluation, so the objectives was not attained. That's why a new strategy called NTB strategy was being performed by WHO. So this strategy has a vision to have 0 death and 0 disease, 0 persons suffering from tuberculosis. And the milestone for 2025, it was to have 75% of reduction of death and 50% of reduction of the incidence of the tuberculosis. But let us see what was the result, please. Okay, so in the last report of WHO, we see that if we compare the incidence at 2015, then the incidence at 2022, many countries have the high incidence. We didn't decrease as the WHO wanted, means more than 15%. Slide, please. Same. So we were waiting 50% less of the incidence. It means that like in our country, in the DRC, we have now 360 cases by 100,000 inhabitants. We must have at 25 and 2025 less than 150, but we don't attain this objective. Only 8% of reduction in the world. Same for the treatments. For the treatments, it's almost good because we were attending 25% more people having their treatment. We have 84%. The drugs are there. The problem is the diagnosis. Slide, please. So the evaluation showed that we didn't attain the objective. The majority of studies reported difficulties for the detection of simple cases and also for the resistance. Slide, please. Okay, so even here for the new test of molecular test. So we can see here that less than 50% of countries could use that molecular test for the diagnosis of a person who had tuberculosis. Slide, please. And we know that many factors can also contribute to the death of tuberculosis, like malnutrition, also like low social economic situation, as we can see in this slide. Other factors are HIV or failing to start treatment immediately, or undiagnosed TB, or drug resistance, or others comorbidity. But we can work for what we can do. It means the diagnosis, the problem, the diagnosis, we can help. That's why we need new strategies to improve the detection. And we think some countries started with artificial intelligence for improve the detection of tuberculosis and then to reduce the spread of that disease. But the problem of our program, our national program, still now they are not using this new tool. We are still now using the traditional strategies. And now we want, and we think that if we use artificial intelligence in as a strategy in our national program, we can improve the detection and the control of this disease. That's why the challenge, we wanted to address this challenge of TB detection and treatment. That's why the artificial intelligence for tuberculosis project aims to investigate the potential of the AI techniques for early detection, accurate drug resistance prediction, and real-time circulation monitoring of tuberculosis in our countries. And the I4TB project, that's what we want to conduct in the 3 countries, have as objective to leverage the potential of AI techniques to improve the early detection, prediction of drug resistance, and monitoring the Mycobacterium strains circulating in our country. As specific objectives, we want to explore the potential of machine learning algorithms in identifying patterns and predicting tuberculosis outcomes using patient data, and to early diagnosis of tuberculosis to differentiate latent tuberculosis from tuberculosis disease. Secondly, to develop new AI-based approach for TB detection and treatment guidance. Third, to assess the effectiveness of these new approaches in real-world context, including the diagnosis drug-resistant TB strains. And fourth, last, to establish a real-time monitoring system for TB spread in multiple countries, including our countries. So this is our team for Morocco, Burkina Faso, DR Congo, and South Africa and Qatar. And we started our advocacy. So last Friday in DRC, the national program organized a day to commemorate the International Day of Tuberculosis. And we took this opportunity to talk about our projects. And in Burkina Faso, our colleague published these notes in an online journal, Faso 7, and the same to show that the AI can improve the detection and help to control tuberculosis. So for as conclusion, we can say that despite the progress in the fight against tuberculosis, the disease is still progressing. And we think that AI for TB project will provide healthcare providers with update information to facilitate quick and effective response to outbreaks and better understand the transmission dynamics of TB in these communities. If it could help to attain the WHO objective and vision with other measures, we can eliminate this disease. Thank you for your attention.
Thank you, Professor Loukia. Very impressive presentation. we will definitely be following your project and can't wait to see what you have in store for us. Thank you very much. Merci beaucoup. Et votre, votre anglais est parfait. So thank you.
Welcome.
Okay, so we can, if you can please stop sharing your slides. Merci. Okay, so we can go ahead and continue with Professor Bruce. Professor Bruce, are you available with the slides?
Yes, I'm working on it. Just give me a second.
Thank you.
What a day with the slides today. I'm sorry.
I know.
It just happens once in a year. Okay, so let me say, given the introduction that I just gave about two important showcases for artificial intelligence, I will focus on tuberculosis. So this is a slide deck for our program for non-invasive AI-powered tools with the LMICs as the focal point here, where affordability and efficiency become paramount. So it is very important to be cognizant of a number of constraints. Of course, LMICs have a small number of doctors, much less resources than the global north. But this doesn't mean that we should just say, okay, well, there's nothing we can do and that's it. You know, artificial intelligence is extremely powerful in making things more efficient with less resources. And that's one of the big functionalities of artificial intelligence that we're trying to unpack through this program. With the same tools that are developed, very sophisticated BME tools for the global north, you can actually use those algorithms and that knowledge to actually improve the situation with showcases in LMIC, in the LMIC situation, the LMIC realm. And tuberculosis is one of them. So essentially, I'm not going to talk about all of them. We have a group of 6 projects, but I'm going to basically be talking a little bit about, you know, the data flows and the procedures to go from image acquisition to data processing and pre-processing, feature extraction, biomarker development, training of the machine learning model. Then comes the clinical applications. So step 6 is absolutely essential because we really want to work with clinicians and doctors on the ground who understand deeply the situation of how to diagnose patients. So clearly, step 6 is absolutely necessary. That being said, step 1 through 5 do play a fundamental role from you know, starting from image acquisition and having the actual, say, for instance, X-rays in the case of tuberculosis, all the way to giving an explainable AI tool to a clinician. Okay, so that's an absolutely, it's a, I wouldn't say it's lengthy nor cumbersome, but on the other hand, it's something that has to be done with extremely good care. And a lot of the ethical questions that emerge as the result of, you know, quick and dirty application of artificial intelligence, because you don't pay very close attention, or we don't pay very close attention to every single step of the way. There's rules and regulations as to how to use artificial intelligence, how to do it in a least possible bias way in order to be able to have an interpretable and ethical tool at the end that the clinician looks at and understands quickly and say, okay, I understand what kind of message comes from the analysis of all this data, and the clinician develops trust in those tools, okay? And then comes 7, because it's very important to be cognizant of the fact that providing a tool, an AI-powered tool, is not just a one-time thing. Artificial intelligence continuously learns from more and more data, especially now that we are in the era of foundation models. And there's a lot of applications of large language models for tuberculosis as well. That's one of the showcases, but you're continuously learning, and the more data you have, directly or indirectly relevant to the pathology, improves the ability to be more and more efficient. So step 7 is extremely important. Once we develop and gain the trust of the clinician, then we have to have this continuous cycle of continuous improvement. So that would be, I would say, the big grand picture of how these tools need to be implemented in the clinical workflow. I'm going to skip the cancer side, but this, I will show 2 slides with the 2 main showcases of how AI comes in for tuberculosis. So as I said earlier, in the case of tuberculosis coming in to improve over classical diagnosis, suppose you have access to X-rays or you have access to CT scans because there's equipment for that. What artificial intelligence is going to do is to be able to improve the efficiency of predictions and improve the efficiency of detection and early detection. So it really improves diagnosis. And this is a classical example of by using deep learning with the data at hand. Suppose you have those capabilities in the point of treatment and a point of care, then you can actually do better and reduce misdiagnosis and detect early. So this is one of the big showcases where AI comes into play, also in the LMIC environment. The second, as I was trying to explain earlier, is when you don't have those capabilities and you have less invasive and more lower cost procedures because of restricted budgets and capabilities, that with the help of AI, we sort of like AI comes in to make up for the fact that your hardware, your analysis tool, say in this case, the ultrasound-based procedure, comes in and is not as powerful as an X-ray. So artificial intelligence comes in with a bunch of other data that the doctor may have, or other digital data that is put together into a picture for a pathologist to come in and say what's going on. But instead of X-rays, you have an ultrasound. So does it mean that this should not be pursued? No, on the contrary. What AI is going to do is to enhance the capabilities of ultrasound by developing TB-specific models that will turn the ultrasound as a low-cost device into something that can be used also as a part of the diagnosis if, for instance, X-rays are not available. So, for instance, you can do it at the level of the screen. So this is really the second showcase where artificial intelligence comes in to help with procedures that are lower cost by enhancing its efficiency and through the development of TB-specific machine learning algorithms. And I think this basically concludes my presentation. Apologies for my technical problems today. Back to you, Chair.
Thank you very much, Professor Bruce, for this presentation. Merci beaucoup. Donc, nous vous rappelons que cette session est bilingual, donc on va parler anglais et français en même temps. Et en passant, bonjour à tous les francophones. Sans plus tarder, nous allons passer à la présentation de Patricia. Dr. Patricia, if you're ready with your presentation, we can go ahead and start. Thank you.
See what I did with the slides. Okay, give me a second, please. Okay, so now you can see my screen. Can you confirm?
Yes.
Yes.
If you could go to full screen, please.
Yeah, sure. Okay. Is it okay?
Perfect.
Yes.
Yeah, thank you so much. Well, finally, thank you again to everyone who has joined today to this TB Commemoration Day, as well as to the Air for Pet initiatives, because we are taking these events to raise awareness about this global disease. So just to move on about the national situation in my country, I just want to give a brief presentation about what is happening in my country regarding TB and what is happening in the region of the Americas region about this disease. So just to give a brief presentation about this issue, I want to show you this global TB report for the last year. And in this image, you can see the different colors highlighted in green and in blue. But what is the meaningful topic in this photo is that this is the change during all these 5-7 years in comparison about the TB number of deaths. So you can see which countries have shown an increase of more than 5% about the number of deaths by TB. So yeah, it's really important that you will highlight these countries and what is happening in that context. So many of the countries that are in blue, they are definitely decreasing this number of deaths. So we can maybe to see that they can get more access to TB diagnostics methods of prevention tools. However, in the majority of the countries from the Americas region, you can see an increase of more than this 5% of number of deaths by TB. So it's really a warning situation for our region. And I want to highlight again that my country is also one of these nations that have this increasing in the number of deaths. So if we can see this, it's crucial that the countries and the region can increase this collaboration on innovations about how we can get access to the TB services and how we can access to promptly TB diagnosis as well as to TB treatment. So, well, it's just the first photo that I want to show you, just to see the overall situation in the world. And just to continue showing this short graph that shows us that by the 2022 in the Americas region, the number of deaths caused by TB continue increasing. This is just like a general overview graph that you can see the mortality rate by the populations per year. So what is happening in our region? What is happening with this number of deaths increasing, even though that the TB is a treatable and a curable disease? And nowadays, there are a lot of methods that you can get to be diagnosed by this disease. So what is happening? This is something that we need to analyze in each country, in each context. However, I just want to show up that maybe there was a decrease due to the pandemic context that is constantly with the 2020 year. So maybe in that situation, we also know that there was an underdiagnostic situation of the disease because they were more focused in the COVID-19 diagnostic tools. And that's why in some countries and in some regions, the disease was underdiagnosed. So, however, now during these last years, the situation, it comes to the normality. And now this warning situation is that even though that we are moving on to the normal situation nowadays, so we can say that if you can compare that to the latest report, it's even more that the latest 10 years. So that's the warning. That's this alert situation that we need to get access to improve the TB treatment, to improve the TB diagnosis, to raise awareness about that disease in our population. So it's just to have a call to to everyone who are in the region, who are in the world, to see what is happening in our country and to reach out to that community needs in order to decrease this number of deaths. That's the crucial role we need to play in this context. So, well, now just to continue about the national situation, I want to apologize because the slides are in Spanish and in the majority of these following slides. However, I will try to summarize as well as I can. Just a brief disclaimer about it is this information is from the national data for the national TB program in my country. So we show out the amounts, this data updated to 2022 in our country. So just to see, Peru is in the south of America, and you can see that our population is around 33 million of inhabitants in the country. So we also have 25 regions in Peru. And I want to highlight these different regions in my country because the one that are highlighted in red show up the majority of cases of TB, the TB incidents about this disease. So you can see this is Lima, the capital of our country, and Lima show up the majority of cases in the country. Lima represents around more than the half of cases nationwide. And also you can see the jungle regions that these are highlighted in red, which is another regions in my country that can show up the majority of cases of TB. As well as you can see the number of new cases and releases about TB around 28,000 of people, and about the MDR-TB, which is almost around 1,000 of people, as well as this monoresistance for rifampicin around 500 of people, as well as the XDR-TB, that this is around 40 people in the country. So the percentage here are really important because it highlights the number of people who are representing the total of cases. And one issue that I want to highlight is that the capital represents the majority of the percentage of the national cases for this disease. However, they also needs to be to analyze that many people from other regions can migrate to the capital because of job or educational opportunities. So the majority of the population are included in the capital of the country. So this overcrowding of people in different centers of the capital could also play a role in the TB transmission. Okay, now I want to show up about the rural population, just as a brief amounts of people. As you can see here, the 1,000 people in the rural population of indigenous people have been diagnosed with active TB, and there are different origins for the people. For example, for the jungle, which can represent 58%, the mountains region that also represent around 40% of population. And something that I also want to highlight during this year is that during the last years, the TB diagnosis is being included in the TB in the healthcare services in the rural population. So this number of TB cases is crucial because it means that the national TB program and the TB initiatives around the country are increasing and focusing in this rural population and these vulnerable people who can, in the majority of cases, they didn't have enough access to healthcare services. So they are improving the capacity of the healthcare centers. As well as to say about the migrant population, that is around 1,000 people who have active TB, and the majority of them are male. And as well as that, during the last years, the TB detection is improving in my country. Now, talking about educational institutions, it's really important that we need to detect where it starts the TB transmission. So we know that maybe in the overcrowded residence or in overcrowded transportation, you can have this first contact for the TB transmission. However, we also need to screen and to continue improving this detection for TB in some vulnerable people, children, for example. So during these years, there are initiatives that are focusing more about the screening in educational institutions, as well as the initial or primary, secondary levels, depending on that. So you can see in this graph that around the 3,000 of children are diagnosed with active TB, as well as above 18 years, that are around 2,000 of people with active TB. So it's really important to detect if they're in this educational institution, you can detect a first index case. It's important to create the preventions strategies to not allow that the disease can spread more in that institution. Just following with the presentation, just to show about the HIV co-infections with TB. And you can see the graph of the country, and in the jungle region, again, you will highlight the high risk for this co-infection, HIV-TB, as well as the capital that also represent one of the main regions with the majority of cases with HIV. So it's really important to continue creating this collaboration between the National TB Program as well as with the HIV program in order to detect and to implement some rapid diagnostic testings to detect TB in this vulnerable population. We know that the HIV people have a higher risk of contact for this disease. So it's really important to create these new programs, these joint programs, to improve the TB diagnostic services. And that's again about the numbers that I have shown in the initial slides. It's about the MDR TB cases in Peru. And as you can see, it's again in the jungle, the majority of cases, as well as in the capital of Lima. And about the XDR, the majority of cases are here in the capital in Lima, and some in the coast in the north of Lima. Okay, just to continue, finishing talking about some amounts of the national situation of TB in Peru, I also want to discuss more about the introduction of these digital health and AI innovations that the National TB Program are working on. So they are improving and trying to include these applications for the virtual directly observed therapy in patients, in the healthcare workers. So in that way, the treatment could be not so not so difficult for the patients to get access to the. We know that the patients are really busy. They are workers. They have the time availability limited in some way. So this application can give the freedom of the participant, the patients, to be at home, at work, and just to confirm the take of pills of the treatment. And in that way, the healthcare worker also can check it, and we can improve this overload of patients, or the waiting list of patients in the healthcare centers for an in-person appointment, just to take the pills for the treatment. So this is a new tool that they are improving in the national context. As well as regarding AI tools, there is an initiative nationwide that it's a chatbot that is called Saludablemente, or it refers about the mental health of people with TB. That this is another crucial topic about TB, about the stigma and discrimination of people, about people who have cough, chronic cough. So if we can create this chatbot to detect like the first symptoms for depression or anxiety, or feeling under this stigma of the disease, this chatbot can guide the participant, can guide the patient in order to create awareness about the mental health issues regarding that disease, as well as the introduction of diagnostic methods focused on AI tools, as well as the CAT for TB, which is a chest X-ray AI tool that can improve the capacity of the healthcare workers to detect an X-ray and to detect abnormalities in the X-ray that could be suggested for TB or not. So it can also increase the capacity of the healthcare centers about the diagnostics or the screening of the disease. So just in general conclusion about how is the situation in Peru and what could be the approaches that we wanted to improve are mean that yes, we have 25 regions, and it's crucial to work in each of them, to detect, to screen people, to create awareness about the disease, about the symptoms, because many of people just think that a cough, a chronic cough, a cough for more than 2 weeks, it's normal, but maybe it's not. So it's just to create awareness, to improve the education about the disease transmission, about the symptoms, and to reach out these vulnerable populations in order to screen and to first detect the disease, and as well as to improve the healthcare capacity with rapid methods for diagnostics. And finally, just to talk briefly about the initiative that is leading by the Peruvian team in the AI for Pet network. We are working in respiratory diseases, which has a high burden in our population, mainly TB, but as well as COVID-19, flu, and respiratory syncytial virus, because many of these respiratory infections have similar symptoms. So it's really important, if we have these several infections that have similar symptoms, how we can help or support the healthcare workers to detect, to get a rapid detection of the disease. So we are working about the cough monitoring with a cough monitoring AI tool in order to classify and to create this early warning system about respiratory infections. So by just coughing or by a cough record, you can classify your cough in order to see if it's more suggestive for TB, it's suggestive for COVID, and in that way, the personnel or the health centers can support the participant, the patient, in order to get an early treatment and to stop the spread of the disease. So our main objectives are to set this cough monitoring based on AI, for respiratory infections here in Lima, Peru, as well as to do the evaluation of this longitudinal monitoring of cough sounds related to the frequency and the pattern changes about the cough sounds. For index patients, as well as to the high-risk contact. So it's really important about this project that we wanted to detect or to stop the transmission. So it's crucial to evaluate the role of the high-risk contacts in order to see at what time we can start with symptoms, or just to see if the pattern of cough can give me some hints to the detection of the disease. So this is some of the procedures about the cough recording of the index patient as well as the high-risk contacts. And we are also working with samples for the TB diagnostic as well as to the other respiratory infectious diseases. During this longitudinal cough monitoring for 7 days, and in the case of contact or high-risk contact for TB, we are working with the 6-month follow-up. And this is just procedures flowchart about the index cases and about the suspicion of these diseases, as well as to evaluate the eligibility criteria, and if the participant of the patients can enter to the study, then we can recollect the data for the participant, the clinical data, and to train using the AI for cough monitoring, and to collect the specimen for the TB diagnostics or the other respiratory infections. And finally, the follow-up for 7 days. And this is the flowchart for the high-risk contacts. This is quite similar for the previous one, just adding the follow-up for the high-risk contacts for more time about the contacts for the TB patients. And well, that's all about the initiatives for the AI puppets for our country. This is just the final procedure about the quality procedure. That is very important about the implementation of AI tools in our context. So the final user's perspective, expected to implement and to analyze the feasibility and acceptability of the tools. And finally, just to finish the presentation, I was to finish with this cartoon and to ask the people, what does the future hold us to improve the access to a timely diagnosis of TB? So in order to get this promptly TB diagnosis, how it could be our future, how we can use AI tools or new diagnostic methods to reach out the goals to decrease the TB mortality and the TB cases in the world. So that's all for now, and thank you so much for your attention.
Thank you so much, Dr. Patricia, for this great presentation. I really love how you pointed out TB transmission in educational institution, and also the fact that you spoke about vulnerable groups. And I'm sure we'll have time in the Q&A to discuss about it. So thank you very much. So without further ado, we will move to our next part of this presentation, this session, which is basically the Q&A. And as a reminder, the audience can drop all the questions in the chat, and we'll go ahead and read them to the panelists. So my first question, so I'll be asking the questions, and you guys can decide who can answer it first. And what I would love for you to do is, before answering the question, if you can, please introduce yourself, because we didn't have time to do it earlier. So just introduce yourself, and then you can answer my first question. That way we can get to know you. So the first question is basically, we already talked about it and the reason why we're here today. So what is the significance of the World TB Day? So Dr. Jude, do you want to start?
Yeah,
I mean,
thank you so much, merci beaucoup, Gillian. This is about creating awareness. How do we eliminate it? Remembering the impact, we've all listened to our colleague from Africa to Middle East and North Africa, to Latin America and the Caribbean, advocating for action. And this is what—
I'm sorry, I don't want to interrupt you, but we want you to introduce yourself first.
Yes. Oh, okay. Thank you so much. Thank you. My name is Jude Kong, and I'm the Executive Director of the Global South Artificial Intelligence for Pandemic and Epidemic Preparedness and Response Network. My role is always mostly about how do you make artificial intelligence actionable to help government and communities solve the problems they have. And TB happen to be a very, very crucial issue that we are keen on looking at. This is one of the first contagious diseases that is dealing with a lot of people in the global south, including communities where I come from. And to me, I cannot sleep unless this problem is solved, because each time I sit with community members, the first thing is around TB. Having lost my grandma and other people to TB, this is something I really care so much about. Raising awareness on these issues, because people may not know, since it's affecting people in particular region, is very important on this particular day. And I want to thank the IDRC that emphasize and create great researchers across the entire global south to address this issue using novel technologies. Remembering the impact on communities and people we have lost, people that are dying currently right now, that we're talking right now as we're talking to TB, is very, very important. Advocating for action. How do we use technology? How do we push to use this? It's very crucial to me on this particular day. Global collaboration. And I want to thank the IDRC that is able to bring us together from all of the global south, every region of the global south, every country. We now work together where people in Africa talk to people in North Africa, Asia, Latin America, and the Caribbean, and Canada, to be able to see how do we join forces together to solve this issue. But this will never have happened without the IDRC. So I really want to thank the IDRC for that. Global collaboration is very important, and promoting innovation. We listen to our colleagues in Peru that have created a tool where you diagnose at home. We all know the problem to disease, especially infectious disease, is about testing, diagnosing. And if we can create tools that people can test themselves, I don't want to call it point of care, but point of need, where they need to test it. If you feel something with your throat and you test it immediately and you can get that data somewhere, that data can be made actionable, that's very important. Our colleagues in Peru, our colleagues in South Africa, our colleague in the Democratic Republic of Congo, and across the entire global south have done this. And I want to thank the IDRC for supporting them to do this. To me, this is the importance of this day. Creating awareness that this was one of the first contagious disease, and that it continues to kill a lot of people, kill a lot of our loved ones, and that we have technologies right now. If we channel that technology and just take a little bit of attention of our time to put on that, how we can use that technology, we'll get rid of this. And this is the work that our colleagues in Peru, South Africa, Morocco, and across the global south are doing. Thank you.
Thank you, Professor Jude. We welcome Professor Cesar. Professor Cesar, if you're ready, we can go ahead and have you answer, introduce yourself and answer the next question. Thank you.
Hello, good morning from here. I don't know, maybe it's good afternoon and good night in other places. I'm Cesar Ugarte. I'm an associate professor in epidemiology in University of Texas medical branch, and I'm part of the team in Peru working in artificial intelligence for preparation in pandemics, specifically in respiratory infection, as Patricia just explained. No? So I'm happy to be here and participating. As Jude said, is an important day to remember how things we need to do to address this big global health problem. No, is probably tuberculosis, as many other diseases, but tuberculosis is an example how unequal is our societies and how we need to address that. No?
Thank you very much, Professor. Professor Bruce, or anyone else?
I can.
Yeah, I'll be quickly.
Please go ahead.
Oh, sorry. Can I come in? Can you hear me?
Yes, we can hear you.
Sure. So just echoing what the other two colleagues have stated, and coming from the technology side and data science side, I think this day raises awareness about the fact that technology, frugal technology, cost-effective technologies can have huge impact on public health, not just in TB, but in many other areas. And AI serves as the conduit to connect these more cost-effective procedures that will be accessible to a wide range of people, much more so than using classical approaches in order to really deal with the problem of disease and TB in particular, and mitigate its consequences in LMIC countries. So this really opens a door of opportunity to basically raise awareness that AI is fundamentally empathetic, is fundamentally equitable, is fundamentally good for humankind, in that it allows for the spreading of knowledge to a much wider range of cohorts than we have today. So we just need to embrace it and work with clinicians to ensure that we have successful showcases that we could propagate further globally through our networks and newspapers and other outlets to say, look, this is how it works. And these are examples where we started from data and we ended with a clinical decision. Thank you. Back to you.
Thank you very much, Professor Bruce. Professor Yahya?
Yeah, bonjour tout le monde. I would like first to thank the organizer for this important initiative and this opportunity to discuss the leveraging of IA in the fight of TB. I would also, we have to recognize the extremely important support we have from the Canadian International Development Research Center. So many thanks for the IRDC. And for me, World TB Day is all what has been highlighted by my colleagues, but it's also an opportunity to convey messages to policymakers, decision makers, scientists, technical experts, and so on. So everyone knows now that TB is as old as humankind, and this is a bit shame because it demonstrates that medical treatment was not developed enough to eradicate this major concern and this major issue. So if I have messages to pass to the public and to the policymaker, is to make it clear that IA, of course, it's a robust and great opportunity, great potential, but we should consider it as an added value to existing strategy and controls, and it's not meant to replace the country strategy to fight TB. This is the first message. The second message I would like to convey, it has been also highlighted by my colleague Jude. In order to success the implementation of IA, we need a huge partnership between, huge collaboration between scientists, because the scientists, they are the guys that will develop and advance research, they develop algorithms and so on. We need also technical expertise, because this is the when it's matter of real implementation of these techniques on the ground, we need technical expertise. We need, of course, the full involvement of policymaker, a full involvement also of the what I called affected community, because in order to ensure the acceptability, you know, because it's not easy sometimes to track people with IA techniques. So to have it accepted, we need also to engage those that convince the large society. So this is the second message. Another major issue, I guess, is with ethical things. It has been highlighted by my colleague Bruce. A huge effort should be made at this side in order to make it available also for the people which have limited resources, because TB in general, it has been discussed in the previous presentation, it has been completely forgotten in the north, but majorly affect country with limited resources. And one of our colleagues in the consortium, Dr. Mzibri, call it la maladie des pauvres. So we should work to make IA facility accessible to all kinds of social categories. And my fourth message, it's important to build capacity building. I mean, in order to make it applicable, and we should also invest in the infrastructures, because hospital clinics are lack all the time facilities in order to apply these IA techniques. And I will maybe profit from this occasion to ask Jude, maybe this is a message to transfer to our colleague in the IRDC. It's crucial. You have started, you have all the ingredients to reach it. Maybe it's crucial to think about establishing, like, let's say, regional or continental research center focused on IA for TB. And thank you.
Thank you so much, Professor Yahya. And I love how you spoke about some of the questions I was going to ask, but you just talked about it. So I don't know if Dr. Patricia and Professor Loukia wanted to answer the questions about the importance of World TB Day. Otherwise, we can move on to the next question.
Si je peux parler en français?
Oui, s'il vous plaît.
OK.
Vous
Oui.
avez besoin que je répète la question en français ou bien?
Oui, non, j'ai compris la question.
D'accord. Merci. Allez-y.
Ouais, cette journée, quand on prend le thème même de cette année, ensemble, nous pouvons mettre fin à la tuberculose. Donc, ça veut dire que les efforts doivent être mis ensemble. Ça veut dire qu'une seule stratégie ne peut pas combattre, une seule structure, une seule organisation ne peut pas. C'est une maladie qui, on a vu, il y a des facteurs, quand j'ai présenté d'autres facteurs qui font en sorte qu'il y ait un taux élevé de mortalité. Donc, il faut vraiment un effort d'ensemble, un effort commun. Et c'est pour ça que nous devons faire du bruit pour que tous les partenaires nationaux ou du consortium ou internationaux, que tout le monde sache que ce n'est pas avec un seul une seule stratégie, mais il faut que tous, parce qu'on a vu le statut socio-économique aussi importe. Donc, vraiment, c'est un effort d'ensemble pour qu'on arrive à mettre fin à la maladie. Et comme l'intelligence artificielle est un outil nouveau, on l'a dit, donc on doit vraiment se battre pour que d'abord les gens comprennent ce que c'est en respectant les normes éthiques, comme l'a dit Jude, pour que finalement la stratégie puisse être incluse dans les autres stratégies pour qu'on arrive à mettre fin à cette journée. Voilà ce que je pense, moi, de la journée, cette journée internationale de lutte contre la tuberculose. Merci.
Merci beaucoup, Professor Loukia. Dr. Patricia, you wanted to add something?
Thank you. Just to add something about the other comments for the panelists, the importance of the World TB Day, as I see, is to join a force for all the sectors that are working on this fight against the TB worldwide. So it's really important if we can join medical doctors, if we can join nurses, socialists, policymakers, everyone who are involved in this fight against TB, and also creating community-based strategy. It's crucial that community is the main role of this fight against TB. So it's just a call to continue involving more people, everyone in this World Day. Thank you.
Thank you, Dr. Patricia. And you were talking about communities, and that will take us to my next question, which is basically, what role do you see communities playing in the successful adoption of AI-driven TB interventions? So I don't know, Patricia, since we started talking about it, do you want to go ahead and start?
Yes, just to respond briefly. If you want to implement AI tools, the community is your final users. If you are wanting to implement, the acceptability for that users are crucial. So you cannot develop an AI tool without thinking about the community, without thinking about the perspective, how useful could be, or if about the safety of the people. And nowadays, talking about the privacy concerns of the ethical approaches, it's critical that you need to include the population, to include the community, and to see if this AI tool could be dangerous, if it could be safe for that people, and if they allow us to use that during all this TB process for the detection. So it's talking about acceptability and feasibility of using that tools.
Thank you very much. Professor Jude.
Thank you very, very much. And when it comes to communities, there's one thing about AI for PEP, artificial intelligence for global artificial intelligence for pandemic and epidemic preparedness and response. And this is the way the IDRC have been working for multiple years and coming together to put this network. The first thing that we do is you learn from the communities. So if you go to Morocco, like my good friend, Professor Yahya was speaking, when you listen to the way it may be transmitted, you see with the communities who care so much about eliminating this. The way it's transmitted in Morocco may be a little bit different, but again, you need to sit on the table with the communities to learn how this is transmitted so that you integrate that data in the training set. And that is a job that Professor Yahya has been doing for the past few months, sitting together with this, not just relying on Morocco. Then you go to another community and said, can we get the data from these communities, learning how it's transmitted in this community and how that from this community can influence what is happening in Morocco or in Peru. Then you work with those communities. So it's very, very important that as researchers, we sit with the communities, we co-create the AI models that we are creating with the communities that will lead to the solution to eliminate TB. We act with these communities. It's only when we learn from the communities that we'll be able to identify the key variables that will eliminate this. So community become very, very, very vital because we need, if it is about the community, they know better what is happening. So IDRC and Together AI for PEP is moving away from that model where we will go to a committee and say, you need to use this tool to eliminate TB. No. In Peru, what Patricia is doing is Patricia is sitting with communities in each local communities every day, learning from them how TB is being transmitted within their community. And Patricia is collecting that data together with the government and building these tools that can be used to eliminate TB. And from Patricia, that's the same thing that Professor Yahya is doing in Morocco, together in the DRC and Burkina Faso. That's the same thing that Professor Bruce is doing in South Africa. And that's the same thing that all AI for PEP network are doing across the entire global south. We learn from the community and act with the community. The only way we will eliminate TB is only when we realize that if it is about TB affecting communities, the communities know better than we do. They know the variables that's driving that. And it's only that community that will tell us how we can build the framework that we have in a way that's responsible to eliminate that. This is the AI for PEP way. I want to thank the IDRC that cares so much about that particular approach, that put a lot of effort to ensure that a particular approach is the right way to go. And this is how we are looking at it. And I want to call everyone on this particular TB week to say, if we want to eliminate it, we need to join forces together. Not just joining forces as researchers and going to communities and telling them, this is your problem and this is your solution. No, we need to join forces of researchers that care to sit on the table with community leaders and ask, listen to them and say, I'm a tool. I will build this tool based on what you are giving me to solve this issue. That information should come from them. Thank you.
Thank you so much, Professor Jude. Professor Bruce.
Yeah, I want to echo what has been said before, and bring about the message that we need to embrace artificial intelligence as a very powerful tool to help humanity. And I think there's a lot of, unfortunately, in the media and the press, there's a lot of discussions about ethics and improper use or and whatnot, mystifying what artificial intelligence really is. But the reality is that those that really understand AI and machine learning and have the skills, they have control over artificial intelligence. So a lot has to do with showing the prowess of AI in practice. The only way that people are going to believe in it and believe in all these cost-effective solutions is by basically walking the talk, and really be very smart about choosing the right stakeholders, choosing the right clinical community, and those that are willing to accept, adopt, because they really care about the adoption of new technologies. And through those successful showcases, then we can bring about much bigger change. So it's really about showing success at a smaller scale to bring that scale to a whole new level of growth and development that people in the end will, and governments will have to embrace. Thank you. Back to you.
Thank you, Professor Bruce. Professeur Loukia, vous voulez ajouter quelque chose?
Non, c'est bon. Tout, je pense que c'est ce que exactement Bruce vient de dire qui est important, les deux derniers messages de Jude et de Bruce. Ouais.
OK.
Ouais.
Professeur Yahya, vous voulez ajouter quelque chose ou bien?
Je vais juste ajouter maybe we should develop strategy to approach different communities. It's crucial that without the community, we cannot have this happen. But I think showing just IA data output and charts and so on it's not efficient. One, in order to take profit from this connection with large communities, one should adopt like efficient strategy, and based on our prior experience. And I think the best is to, as my colleague Bruce told us, we should contextualize things, and draw the imperative decision. I mean, in this case, we will tackle the real problematic, and we will answer to the concrete needs in the ground. So that's my point of view on how we should approach large community, because in our our proposal, i.e. for TB, that has been presented by my colleague Loukia, when we started to communicate with doctors in clinics, many ideas pop up, and we are pretty sure that IA and artificial intelligence technique could tackle like concrete problems. I can give you a very simple example. One of the major problem in the clinic is the read of this les lames, les frottis. It takes like 40 minutes because they use it using a microscope, and the technician need to count these bacills. And this is something we can implement. I think we can reduce this 40 minutes to less than, I would say, 3-4 minutes. And in this case, we will relax the charge on technician, and we will repent to real needs in the clinics.
Merci beaucoup, Professor Yahya. So unless Dr. Patricia has something to say, we can go ahead and I'll have Emmanuel read a question from the chat. Emmanuel?
Thank you very much. We have a few questions on the chat. I'm going to read them. Some of them are directed at particular speakers or panelists, and I'll mention their names so you can answer. The first question is, it states that, is diagnosis really a problem as mentioned in Africa, or is it the reach of medical services, which has also been mentioned in Peru? Maybe Peru would like to answer that question, or Professor Loukia from Africa.
Est-ce que vous pouvez répéter la question en français?
Oui, tu peux répéter ça en français?
Okay, let me get the question. Emmanuel?
It says, is diagnosis really a problem in Africa, as mentioned, or is the reach of medical services, which has also been mentioned in Peru? So which is the problem? Is it the reach of services or diagnosis?
Est-ce que l'accès des soins en Afrique est un problème comme mentionné pour le Pérou? Ou les diagnostics?
Oui. Alors, personnellement, je pense que les deux posent le problème, les deux. Il y a effectivement un problème d'accès aux soins, et c'est comme ça que parmi les stratégies, et là, j'ai apprécié la stratégie du Pérou, c'est celle d'aller vers la communauté. Et ça va permettre vraiment de résoudre ces problèmes d'accès aux structures de soins. Mais en dehors de ça, il y a également le problème de diagnostic. Parce que, par exemple, je l'ai montré, l'OMS dit que la proportion d'enfants qui doivent être notifiés de tuberculose, c'est 20%. Jusque-là, il n'y a aucun pays en Afrique subsaharienne qui dépasse même les 14% de détection. Donc, il y a vraiment un véritable problème. Ça, c'est de 1. De 2, les outils qui sont utilisés, et généralement avec les algorithmes simples que nous utilisons en utilisant la radiographie du thorax, eh ben, on passe à côté de beaucoup de problèmes de diagnostic. Et donc, il y a les deux. Il y a, avec l'intelligence artificielle, à mon avis, ça va aider dans les deux secteurs. On a vu le projet AI4PEP va améliorer le dépistage en utilisant les mêmes outils, mais avec l'intelligence artificielle, il y aura une reconnaissance plus facile des lésions qu'il y a, par exemple, sur les radios ou ce que disait le professeur Yahya avec des lames. Ça serait plus facile. Mais au moins, on voit aussi au niveau de la communauté comment le projet du Pérou peut approcher la communauté via l'intelligence artificielle.
Merci beaucoup, Professeur Loukia. Professor Cesar?
Yes, thank you. One of the things, and maybe this is my bias working in TB diagnostics, is we need, it's true that we need new tests. We need something like it's close to the people, very point of care. AI tools can help us, but also it's true that access potentially is one of the big problems for us. I remember, and this is a personal story, then when I doing my PhD, I always do this example when I discuss with some of my colleagues is when I was starting my PhD, my plan was to try to work to find huge biomarkers, big biomarkers, very fancy biomarkers that help us to diagnostic TB, etc. And I remember a very clever colleague in the moment to tell me, you don't need that. You already have tests. You already have drugs. The problem is health system. Health system is not available for the people. And I remember say, of course, with all my ignorance at the moment, say, you don't know nothing. I work in TV for several years, blah, 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 blah. 2 years after, I called her. I remember to say, you are completely right. It's not, of course, we need advanced technology. Of course, we need more clever solutions. But nothing means, or nothing of all these advanced means if we don't put people, the patient, as center of the system. And artificial intelligence need to be one of the tools to put people in the center. If we miss that, artificial intelligence will be another potential solution that never gives the solutions that we need. So I feel like if we need to think about in this World TB Day, and I'm very thankful about this comment in QA, is we never forget that we are working to give a solution to a person that needs a solution.
Very powerful statement, Professor Cesar. I love it. Anyone else? Or should we read another question from the chat since we don't have too many?
So I'll take the next question, which goes to Peru. It says, I want to ask about prisoners or people in jail with TB in Peru. How much is the incidence?
Okay, prison inmates usually in Peru have one of the highest incidence rate of TB. Sometimes TB programs said that if you take out population of prisons, the incidence in Peru go very fast down. What is the meaning of that? The meaning is we are having some problems addressing transmission in the prisons. But one of the things that we, probably in the following week, we will share a paper that we are just accepted for publication in Lancet is if we work TB control in prisons, because there's a lot of communication with community, because relatives not wants to go to visit and get infected. Probably we start to control. And this is something like as a human right. Sometimes we thought, oh no, prisoners is part of her fault. We don't need to care about their health, etc. No, it's a human right. But also, if you are looking for control in the community in general, prisons is part of the community. Prisons, there's half a lot of communication between community. So it's not only because it's the big reason is human right, but also you need to address that a mother need to visit the son there in the prison and get infected there because there's some transmission there. Because there's, unfortunately, is overcrowding prisons in our countries. And we need to address that. And do you know what is the sad part of that? Most than half of these persons don't have a trial yet. So potentially they are innocent and get a punishment, get infected in prison. So TB is a main driver of TB incidents in our country, yes. And this is one of the things we just realized when we did this last study in prisons. But you know, during the pandemic was very interesting because they are confined in a specific place and have a good care. During the pandemic, do you know that they have a better outcomes than in community, for example, for TB? This is one of the results we found in our paper that was just accepted. Is when you have a program that have the opportunity to provide diagnostics and provide treatment on time, you can make a difference. And maybe this is an example for that. And it was during the pandemic. So for example, during pandemic, health centers were closed in Peru. So people don't have access to TB care. But prisons, they have access to TB care because was inside the prisons. And they continue the care and they have a better outcomes than the community outside. So maybe there are some lessons that we can learn also from healthcare in prisons. Nothing is perfect, but we can use these solutions. We have used this experience to improve finally the care of these persons.
Okay, we have two other questions that will go to Professor Bruce. They were directed at Professor Bruce. The first one is there a team who generated TB ultrasound image data set? And the second one is, how do you intend to transfer the results of diagnosis at health facility level? These are the two questions directed to Professor Bruce.
Yeah, so I think we are talking about the ultrasound methodology, right?
Correct.
Yeah. So to my knowledge, most of the work in that space has been performed in India, with whom we have relations, and the use of ultrasound has generated quite a lot of data, I have to say. Because of a number of technical reasons. I would have to look around for the African case, but I do know that Africa does have, through connections between the US and India, there's really a lot of data in that space. There's also you have to also have in mind that there are even cheaper options, like for instance, just putting a microphone in an IoT device, and the way you talk, the way you cough, also brings a lot of information. And these are the kind of things that we're also looking into. But yes, I would say that in the next months, we're going to be developing connections in Africa to test the use of ultrasound at least. And we're also adding a microphone to our devices, to our existing IoT devices, to really start collecting data of coughing in clinics in South Africa.
If you allow me to add something on this concerning the cough analysis, Bruce, there were an initiative in Kenya recently a very simple device, and the setup allowed them to reach like 80% of efficiency in TB detection. It's a bit far from what is required from the World Health Organization, because they require like something like 90%. They are not far away from it. I think if they couple this to, let's say, temperature measurement, thing like that, I think they can reach easily the 90%. So there are some initiatives also in Africa on this way.
Thank you very much, Professor Bruce and Professor Yahya. So I'm gonna have one last question. I don't know if Emmanuel has another question from the chat, but I wanted to know basically if you could share examples of successful initiatives or pilot projects where AI has been utilized to combat TB effectively. So from your experiences, any of you.
French, please.
So just Cesar is on up.
Thank you. So
Okay. Oh, I think Professor Loukia wanted me to say it in French.
Oui, tu peux répéter ça en français, oui, oui.
Ok, donc c'était pour savoir si vous pouvez donner des exemples d'initiatives réussies ou des projets pilotes, par exemple, dans lesquels l'IA a été utilisée pour lutter efficacement contre la tuberculose.
Je peux commencer si vous voulez.
So, oui, oui.
Yeah. Si à l'échelle de l'Afrique, j'ai vu un projet pilote, par exemple au Mozambique. Nous avons discuté tout à l'heure, mon collègue de Pérou a discuté le cas des détenus. Hein. Donc au Mozambique, il y avait un projet pilote où on faisait du screening pour les détenus dans une prison. Et c'était un setup aussi qui est très, très basique. Hein. C'est des images X-ray et qui sont connectées à un programme avec un modèle IA. Et ça permettait très efficacement d'identifier les détenus qui sont atteints de la TB. Et ça a permis de les isoler pour le traitement. Donc, je crois que c'est un des excellents projets qui ont connu une réussite à l'échelle de l'Afrique. J'ai switché en français, désolé pour ça, mais...
C'est excellent, merci.
Mais dans le monde multilangue. Hein.
Oui. Professor Cesar?
Thank you. I think there is in the last years several examples of how artificial intelligence can help. First one, for example, reading of X-rays. There's many experiences that show that can reduce, especially in areas where we don't have a radiologist, we can use chest X-ray readings to that. In our case, we are using a cough monitoring. And one of the things with cough monitoring is not only for diagnostics, it's also to see how is the treatment is going on. And the other thing is, these can help us to not only to see as a silo, because you can see TB diagnostics, but also you can start to look COPD. You can start to look for lung cancer with the same tool, with the same thing. So you expand care for the population. So I'm very excited to see how is the next years of that. The challenge is how to make this implementation feasible, simple, very simple, should be very simple, and adaptable in several settings, rural, urban, different cultures, etc., that help us. And then finally, I think many of you discuss is about confidentiality. Because if we lost the trust of the community, none of these tools can help us.
Thank you so much, Professor. Professeur Loukia, vous voulez ajouter quelque chose?
Non, non. Dans notre pays, on n'a pas encore appliqué l'intelligence artificielle pour la tuberculose. On a une première expérience qui va commencer avec un stéthoscope malin, un stéthoscope qui travaille avec l'intelligence artificielle et qui pourra reconnaître sur base des bruits auscultatoires différentes maladies pulmonaires. Mais c'est un projet qui est en cours d'exécution, on n'a pas encore de résultats. Sinon, à part ça, nous n'avons pas d'autres expériences locales sur l'intelligence artificielle.
Merci beaucoup. Professor Jude, do you want to add anything? Otherwise, I think we can go ahead and move to the next part.
I wanted to point out that there are tools like the one that we're developing in Peru, AfricaCanada is developing in Peru, like the one that we're developing in at Wits University, that will be able to monitor this. If you're able to diagnose at home, after taking into account all the variables, I do see the future bright. I do not think TB is one of the contagious disease, the first one that still exists right now and killing a lot of people. But I think as of today, as of what ideas you have helped us to put together, I think it's right to say goodbye TB. We are getting rid of it with the team that we have put together, with these tools that we have, and that care so much about what's happening in the community. It's really well to say goodbye TB. Now, where is it being used right now? The tool that have been developed in Peru, there are other places, but I want to name what Peru has come up with. It's very helpful. I want to name what Bruce here and his team have come up with in South Africa. I want to name what Professor Yahya have come up with. These are tools that are showing promising signs that will get rid of this. And I like that the IDRC is lying behind and supporting this, and the government in these countries are supporting this. With this support that we get from communities, government, and agencies that have cared so much about development, the IDRC is supporting this with all of their might and power, we believe that we'll get rid of TB.
Thank you very much, Professor Jude. It was an amazing session, and I think we are hopeful in what the future is going to bring based on all the questions and the answers that we heard earlier. Patricia, did you want to add anything?
No, just a big thank you for Jude and for these words to continue joining the effort for all the countries who are involved in the AI for Pet Network, and not only these countries, instead of we can just continue working with another countries who are also worried about this disease. Oh, thank you.
Thank you, Patricia. And I'm glad that we work together as a family. We're a family here.
Yes, yes. Yes, it was an amazing session. And I was so happy to meet each one of you and get to learn what you guys are doing. I'll be following your progress closely and hope we will have another session, a follow-up session to see where you are. So Professor Jude will do the closing statement.
So thank you so much, everyone. Thank you for coming together. I would like to say on this particular day, from what I've learned from everyone, the promising nature of innovation technologies is very vital. But we are glad that it's not the communities that we work with that are seeing the importance of this. As we said, we will not be able to succeed. We heard everyone here today without really sitting down with the communities and acting as tools rather than telling communities what to do. But we have agencies like the IDRC that are willing, caring about these communities, to put in the money to support these great minds, these great researchers, together with the great minds in communities and the government that are very smart and great minds that care about these communities, to sit together with this government to say, how do we eliminate TB? My friends, you won't imagine TB is one of the first contagious disease and it still exists right now. Is it because it's a global south issue? Is it a global south issue? Rightly, it's in a global north. But time has come. From what I've heard from our colleagues in Africa, starting from Wits University, KNUST, Cameroon, Cheikh Anta University in Senegal, moving towards our colleague in MENA, Asia, and Latin America, in particular, our colleague in Peru, I don't think TB days are still long on earth. They're numbered. So for us, with this particular week, as we celebrate this week, it's time we start counting. A lot of us have lost a lot of loved ones. It's not long that my grandma passed away from TB. And so to me, when I start talking about TB, it becomes very personal because of what I've seen the loved ones have lost to this. And knowing fully well that we can get proactive tools. Somebody asks, is it a matter of diagnosis or of healthcare facilities? Once we have proactive tools, all of those combined together, I really love the answer from our colleagues from DRC. I am glad that we are all ready and that we have a panel like the IDRC that's able to support us to create these proactive tools together with the community. I can number it that by the end of AI for PEP project, there will be a tool out there that's disruptive enough that will say goodbye to TB. Thank you all. Thank you for coming together. Please, if you want to join this moment, we have your email, we'll be in touch. There are a lot of projects that we're moving towards ending TB, a lot of events that we'll be organizing from Morocco to Democratic Republic of Congo to Burkina Faso to South Africa to Peru to Senegal to Cameroon and across the entire global south, Brazil, Dominican Republic, and Asia. Please, we want us to join this initiative. We want us to join the moment. If you want to find out how to join it, if you have listened to all of these and you want to collaborate with us, you want to collaborate with the IDRC to support the IDRC in supporting us in the work we do, or you want to collaborate with some of our partners, please do reach out to us. We'll be able to connect you. We really want to work with you. We're stretching our hands together with the communities we work with. Please come and join us. Let's put our hands together. Let's use the Ubuntu principle. All for one, one for all. Thank you so much.
Thank you also to all our audience and for your questions, your participation. We can't thank you enough. Before we end, you guys can just round up, you know. Patricia, Loukia, si vous avez quelque chose à dire comme mot final.
Oui, comme mot final, c'est remercier la plateforme AI4PEP et de vous remercier vous tous pour déjà l'initiative et pour le grand travail qui est fait. Et comme on l'a dit, donc le fait de travailler ensemble et de mettre la personne humaine au sujet de tout ce que nous allons faire pour que la technologie aide vraiment à combattre cette maladie qui semble persister et malgré les stratégies qui ont été mises en place. Je remercie également tous les participants qui ont suivi cette journée. Merci beaucoup.
Merci, Loukia. Professor Bruce?
Yeah, very quickly, I want to thank the IDRC and also Jude's leadership. It's been instrumental in getting the community together and attack the problem by grabbing the bull by the horns, which is let's just walk the talk and deliver solutions to the clinical space. And I think that will make a tremendous difference. So I want to thank everyone for their amazing feedback. And yeah, it makes me feel proud that we're working together. Back to you, Che.
Thank you, Professor Bruce. Professor Yahya, vous avez quelque chose à ajouter?
Well, I will join my colleague to thank Jude pour cet extraordinaire travail qu'il fait. Et à travers Jude, bien sûr, a big thanks to the IRDC canadienne. Et je reviens à l'idée d'établir un centre d'excellence, même virtuel, mondial pour l'IA to fight the TB. Hein. Thank you.
Merci beaucoup à vous et bonne initiative. Nous allons laisser le soin à professeur Jude de s'en charger.
Exactement.
Dr. Patricia, final word?
Yes, just a brief farewell. Thank you so much to everyone who have joined and to show out this interest in this topic about to commemorate the fight against TB. Continue working about this topic related in your countries, in your regions, and continue involved in education and awareness in your populations. Continue working on the community engagement, and I'm really proud to be part of this network. So thank you so much, and just continue with the collaborations that around the world. Thank you so much for this initiative. Thank you.
Thank you, Dr. Patricia. Back to you, Professor Jude.
Thank you very much. I will just thank everyone and pass it over to Emmanuel to end the occasion. Please stay tuned. We are coming up with more activities. Over to you, Emmanuel.
Thank you so much, everyone. I can't thank you enough for speaking today and for all our panelists. It's been wonderful and really enriching. We are really grateful to all of you for your time and participation. I want to thank our moderator, Georgette. She's been amazing. Thank you so much for your time. I want to thank all our participants for the patience. We exceeded our time a little bit, but I think this has been rewarding and it was worth it. So I want to thank you once again, and I want to thank IDRC for its continuing support to us. It's been wonderful. Without IDRC, I think we really thank IDRC for this collaboration and support that we continue to get. And finally, thank you, our CEO, Professor Jude, for leading this endeavor. Thank you so much. Bye-bye.
Bye. Thank you. Bye.
Thanks, everyone. Bye-bye.
Bye-bye.